that, I'm happy to give the floor now to the third speaker, which is Stef Kremers. He's professor at the Maastricht University, professor of obesity prevention. And you will talk, Stef, about how does this work contribute to the future of school health promotion and school health promotion research. The floor is yours.
Yes, I have been a professor in obesity prevention for a couple of years, 5 to be exact, and I did that with a lot of enthusiasm. For the past couple of years, I've been professor in health promotion, so actually broadening my scope beyond obesity prevention, but it's true that I still do quite some work in the area of obesity prevention. And I will indeed take this opportunity to, well, to think a bit along with the audience about the future of health promotion and health promotion research and what the results that Nina and Kathelijne just elegantly presented might mean for this future. I took this graphic that you can see on the screen now because it might seem that while Nina and Kathelijne were talking about dynamics in school health promotion, that it was still, that you can still interpret this as some kind of stable thing, that you are at a certain position on a certain spectra on a given point in time. But actually, what Nina and Kathelijne have been telling is something that looks like this. So you can put it on a spectrum, but in essence, in real life, schools work like this. Very dynamic, constantly interacting elements, and also not only within the school setting, but also beyond the school setting. And well, if you look at the world from that perspective, then there are a couple of implications that I would like to discuss with you. And I put them on this screen as some kind of warning. So each of these points I will go into some detail in the time that I have. So starting with this life course perspective, I think it was very interesting that the European inventarization that Kathelijne did showed that the attention for health promotion at schools appears to decrease while children get older. And that's actually rather strange, especially I think many of the people in the audience work in a university setting, or at least work with professionals that are trained at an academic level. And we have seen here that, you know, the school as a university is also suffered from the COVID epidemic quite drastically. So our students really suffered from it. And it's actually strange that the universities tend to give little or hardly any attention to health promotion for their own students. And I think that the same goes for other higher educational levels. And you see it actually decreasing as children get beyond primary schools, which is actually kind of strange. So I would like to advocate, and I hope, and I think that's also the future of school health promotion, is that, that this life course perspective is taken. So health promotion is already there at preschool level, at kindergarten level, and is continuously there. The attention for health and health promotion is continuously there as the children grow older, up until they are at the end, towards the end of their school career. So it's actually kind of mixed hope about where I think the future is and where I hope the future is. And let's say I hope I am correct. And another thing where I feel and hope that we are going towards is the contextual approach that was touched upon by one of these spectra as well. I think we are giving much more attention to so-called upstream determinants of successful implementation. So not only the tips and tricks that you can do as an advisor of school health promotion, but also taking into account, for example, deep-rooted cultural factors, deep-rooted organizational factors that are present at a particular school. And then you need to do different things, and sometimes more intense things, than just handing over a couple of tips and tricks for schools, because that doesn't work in most cases, we know. And the last thing that is accompanying a contextual approach is to see the school as part of a broader system. So it's not the school as some kind of isolated place on an island. No, it's part of this broader system. And if you look at it from this systemic approach, then you need to take into account non-linearity. Nina already said that sometimes a lot of effort is put into schools, and I know many people in the audience that are working in the field have experienced this, putting in a lot of efforts in helping the school climbing this hill towards a healthier environment. And sometimes it works for a bit, and this ball is leaving this basin just below there, and you see some kind of successes, but if you stop putting in effort and attention, typically the ball rolls back to the basin again, and to this so-called attractor state. That's where the school wants to be, in the attractor state, which is the state that people do the things as they have always done, routines, following the way that the way of working has been formed over the past, sometimes even dozens of years. And it's very hard to help schools move beyond that. So a lot of effort, no effect, or hardly any. Very non-linear. Luckily, the opposite is also sometimes true. That's what gives us energy, right, as health promoters in schools. When we encounter a school that is at a tipping point. So asking you to give them this final push by using a particular word, or by introducing them to a particular person, adding something to this system, the crucial element, and a huge effect is taken. And the school is drastically changing the way the system works in order to facilitate healthier behaviors in the system. And that's a so-called tipping point. We call that a tipping point, or in the systems theory terms, a bifurcation point. So relatively few attention, few effort, but huge effects. Also very non-linear. If I take too long, the host just interrupt me. Yeah? It happens sometimes when I get enthusiastic, then I take more time than I have.
You're okay.
Okay. In the systemic approach, actually what you do as someone who stimulates a healthy school approach is create feedback loops. So observe and feedback. And so the school is helped in that way to take actions that might be out of sight for someone who is in the system themselves. So in this process of navigating, I think that what the research up to now has shown that this idea of navigating is a very central skill for professionals. So I think good professionals that stimulate health promoting schools are very good at navigating. So that means that they have a competency to be flexible. So not to have, this one box of tips and tricks, put them on a desk and hand over some tips and tricks, and the same box is for everyone. No, I think good health promotion is about feeling what a particular context needs. We sometimes call that contextual sensitivity, and then navigate on each of those spectrums to the point where you feel, okay, this is the point on the spectrum that I have to take now in order to help this school in an optimal way, and in order to help the school adapt to this particular situation. You might call that mutual adaptation. Taking some point between very top down and very bottom up. And this competency, I think, should be trained better. So that's a responsibility that I take as someone who trains professionals in the future to be able to navigate better. And in the organizational literature, it's also sometimes called adaptive management. Adaptive management. So I think our professionals should be scoring high on adaptive management. Otherwise, they can't function properly. You know, just going through your protocols, going through your steps, same way every time isn't going to work, at least not for those schools that are not at a tipping point. And the last point that I want to make, in line with one of these spectra that Nina already presented, I think that if you take a research perspective on school health promotion and health promoting schools, we need to navigate as a research community towards the end of the spectrum that is action-oriented. I think we need to move beyond RCTs. Of course, RCTs are sometimes good, but in very rare cases where we need to test efficacy trials and test whether a particular isolated intervention might work, very good. But for the remainder, I put much more value in participatory approaches, where the researcher is a member of a team and is a person that also takes responsibility for creating feedback loops. And that also means for the PIs among us that we need to dare to design research without predefined output or outcomes. It's very challenging, also for our grant offices, because they want to know what they are subsidizing. But in essence, if you listen very carefully to this webinar, I think it's sometimes very difficult to predefine where we are going in a particular context. So we need to be, well, a bit of thinking outside of the box and don't have predefined output or outcomes of our efforts and convince our subsidizers by the fact that this is actually where we need to go. Well, we are thanking a lot. This is the third time that you see this slide, but we are a very thankful people in Maastricht, you know.
Thank you so much, Stef.